So, Lakia, this is an amazing story. In terms of your symptoms, is it the muscle spasms that bother you the most, or what are the symptoms that bother you the most? And how did the cannabis help with or address those major symptoms?
Great question. So yes, the muscle spasms are probably the worst of it. It's a constant, ongoing, never-ending process. My muscles want to draw up and become rigid, and I want them to stay relaxed and cool out. And the cooling out of it is where the cannabis comes immediately into play. So for me, the way this kind of worked was my treatment plan consisted of Valium, an IV Valium Q3 every 3 hours. I forget how many milligrams, something totally outlandish. So to get away from the Valium, I needed to find a plant to replace it. So the plant that I used to replace Valium specifically was Northern Lights.
Oh, okay. Okay.
Northern Lights became my Valium, right? It's if I want to do this, then this will do that. And it worked in my, it worked for the muscle spasms. It helped get me to sleep. It helped keep my body and my muscles nice and relaxed and nice and leveled out, mellowed out. So that was for that. For my nausea and for my appetite, green crack was the thing that really helped. For ulcerative colitis that I deal with, a Boss Hog RSO is.
Sorry to interrupt you. I have had patients with amazing success with Crohn's disease and ulcerative colitis. Now that's a hard one to treat. It's very hard to treat, first and foremost. But with RSO specifically, and RSO means Rick Simpson oil for those folks who may not be aware of that. And I just posted a study on my LinkedIn this week about cannabis, and I believe it might have been Crohn's or ulcerative colitis. They're very similar. And it was an inhaled cannabis that helped the digestive tract. And my question was, what if they would have used an oral? It could have acted hypothetically as a topical effect. Anyway, I interrupted you there,
Oh, no,
but
that's a
before I
great.
also forget is when I first learned about medical cannabis, I had been familiar with it on a recreational side, but I actually had two patients in a row, very back-to-back patients come in a row, and they both had taken themselves off of the exact same two different benzodiazepines, which is in the same family as Valium. And so the first one, I didn't even cause a blip because I said, "How did you do that?" And they said, "Marijuana." Okay, I don't have a problem. I'm not super judgmental. When I was in the clinical environment, I was not. But the second patient, I said, "How did you do that?" And they said, "Medical cannabis." They didn't use the marijuana word. And the difference in the word and the stigma that I had attached to it turned a light on in me, and that's when I started doing my research. This must have been in 2008, 2009. Anyway, I totally cut you off there, but Valium, that family, I think that cannabinoids have, or at least an option folks may want to consider with their doctors.
I
Go ahead. I'm sorry.
absolutely no. Listen, Dr. Felice, you're absolutely on point. I could not agree more. And to that point, right? So the way the way I wound up using the Boss Hog RSO, this is gonna be odd, and I apologize for my little bit of embarrassment on the front end. So I learned to turn it into a suppository.
Oh, that is totally, really legitimate and good. It's just we have a cultural thing around that. But go ahead and please continue.
Right?
It makes a
So
whole lot of sense, actually.
and well, here's why. Because dealing with ulcerative colitis, I had providers who were really quick to want me to take steroid suppositories, and it didn't really set well with my spirit. I really had to give pause to that. I understood what they were going for, but in my mind, my first thought was, can we not try something a little less possibly demonstrative to my human self first? And if that doesn't work, then okay, let's maybe try something a little more aggressive. But that seemed very, to me, that's like hey, you have an ant problem in your kitchen, bring in the TNT. Like, whoa, that's, so that was my response to my provider at the time. Well, one moment, doc, can we discuss, how about this? How about I try using a medical cannabis suppository? I will work with the pharmacist at my local dispensary to make sure I have a clear understanding, and then we'll consult back. And how about we meet back? And if I'm not doing better, or there's not improvement, or then we'll look at other courses of action. I'm happy to review other things. But first, let's maybe try something that might do a little less long-term damage to my human self. And he wasn't crazy about the idea, but I'm real quick to fire providers if they're not in the right place and space with what my personal goals are. And their expertise is super, super appreciated, but also I spend a whole lot more time with me than they do. So, I think I have an idea of kind of at least what is going on within my human self. And I try and be kind of articulate, about that. So that's exactly what I did. I went to my local dispensary. I had a conversation with the pharmacist. I realized a lot of patients who go to medical dispensaries don't even know that there's a pharmacist on staff for a lot of them, most of them. But I did. So I went and talked to the pharmacist. He was awesome. And he pulled up some information and sent me a whole packet on how to make my own suppositories. And
Oh, wow. That's great.
yeah, it was awesome. And I want to say within the first 24 hours, the pain and just tightness and swelling that I had been experiencing was easing up. And, within maybe 3 days, my symptoms had completely receded, versus when I had done steroid treatments in the past, it took 7 days before I had any relief at all. So it cut my recovery time in half, at least.